Hey friends, welcome back. We'll look at broker analysis documentation. So what I did is I created some sample documentation. I couldn't share the actual documentation provided by the broker because of legal and confidentiality issues. So what we're going to do is we'll look at some sample practice stats that I created, and I'll go over some of the important aspects you need to look at as part of your evaluation process. So this Excel sheet that I've created two sample practice. One with the net revenue, which is lower than the other, and the percentage aspect of it. What percent of money is being made. Okay. So in the first, if you look at it, we have year 2015. And the gross revenue I have kept the same. So the idea is to go about what you should look for when you are evaluating the practice. So in 2015, gross 450, net 125, and percentage of overall income to gross ratio, net to gross ratio is 27. Then similar 2014, 500k, net 135, 550, net 145. So approximately 26 to 27% of the net of the overall gross. So this is on the lower side. Any practice that is doing above 43, 44% to 50, 55% is an excellent buy, versus any practice that is doing 25 or 30%. So the reason is you have your margins already optimized because the existing owner is doing very good. Okay, another aspect you need to look at, from last 3 years or last 2 years, the overall revenue is declining from 500 to 550 and to 400. This means doctor is not putting too much attention to increase the revenue. Whatever is coming, that's fine. You will find this similar cases where doctors are looking to retire. Okay, anybody who is young and selling the practice because of some other reason, or if they're moving out of state or other issues, you will not see some trend, something like this. Okay, so what I did is I created the gross of 3 years. So basically the way gross is created is there are multiple factors that a broker would consider in coming up with the multiplying factor. Okay, so multiplying factor is the factor which after certain calculations they will multiply to come up with the overall practice value. Okay, so if you look at it, the method we have used is we have used the average gross. So we multiplied the current revenue with 3, the 2000 revenue with 2, and 2013 revenue with 1. So we are giving importance of current revenue maximum, then the last year 2, and the 2013 as 1, and then we divided by 6 in order to come up with an average revenue. Okay, and we just arbitrarily took 0.7 as a multiplying factor. So average gross into 0.7 is 338k. So as per broker, they would say the price of this practice is 338k. Okay, so I've given the formula for coming up with a gross. So now look at the practice number 2. Okay, if you see the gross numbers are similar, net is much better than the earlier one. So net is 190, 210 and 250, and the percentage is 42, 42 and 45. Given a choice, my recommendation would be to buy a practice which has more percentage ratio to net to gross versus less. Anything again that is around 50% is an excellent buy. Don't look at the price, because even if you're paying 100k extra or 150k extra for an optimized practice, you will cover up this money in probably next 2 years. Otherwise, on the other hand, you have to spend money in marketing. You have to optimize all of your resources in order to get to a profitability of 40 to 50%. Okay. So in this case, we have taken the multiplying factor as 0.9, and that becomes price of 435. So the reason of 0.9 is because this practice has better profitability, and the take home for the buying dentist would be more as compared to practice 1. Okay, something to look at. So what does go into deciding a multiplying factor? Okay, there is no exact science. This is all subjective criteria. So what I think are important is net profit. So based on our discussion earlier, net profit is one of the most important aspect in deciding the multiplying factor. So usually multiplying factor ranges from 0.5 to 1.5. Okay, demographics, income level of the resident. So any practice with a lower income group would have a lower multiplying factor as compared to practice in a higher income area. Okay, type of practice, insurance and fee for service practice would have higher multiplying factor, and Medicaid would be lower because you have to work probably 2 or 3 times to get the same amount of money. So fee for service high, insurance medium, and Medicaid low. Okay, number of new patients. So a practice with a healthy inflow of patients. So you have 20 to 30 patients new coming every month versus 5 to 10. The multiplying factor would be more for a practice where you have more number of patients coming in. Type of procedure. A basic bread and butter dentistry would have lower multiplying factor versus somebody who is doing a sleep apnea or implant based practice. Okay, leaseholder improvement. So what kind of improvement has been done by the dentist in last 5 to 10 years? What is the condition of the equipment, so and so forth. If the ops are 20-30 years old, you're looking to in next 3 years you will have to change all those operators, and you need to think about it. An average good op would come around $15,000. Okay, number of working days. So given those numbers, is the overall 450k revenue is being produced in 2 days versus it is being produced in 5 days, makes a lot of difference. So if it's being produced in 2 days, you still have 3 days you can work as an associate to manage your expenses, pay off your loan, and you can slowly build up your practice. If it's already taking 5 days, you have no room for that. So these are some of the aspects you need to look into when you're evaluating the profile. Okay, so what I've done is I've created a small illustration of how would you see the money that you will take home. Okay, so in 2016, usually they say you will grow your practice by 5%. So I've considered 5% growth. So 190, 195, so on and so forth. So this is your take home income, and then you have loan of 500k for 6%, and assuming the total interest is 150. I didn't calculate exact, so just some of the numbers, and assuming you have 7738 as a monthly payment. Okay, so accumulating it over 12 months, and then you have to pay this much money for 7 years in order to have the 100% ownership. So if you look at it, this is the money that you will be taking home: 97,144, 106, 116, 127 after the purchase of your practice. So that is not a lot of money, but you will think, hey, I'm making more money as an associate than this. But the fact is, in 6 years, you will be accumulating $500,000, and which you will not do if you're working as an associate for somebody. You are accumulating money for that person, not for yourself. But at the same time, you need to understand how much What does it mean if you buy a practice? It comes with a lot of responsibility, extra hard work, and a lot of stress. So that's it in this lecture. I will see you in the next lecture. Bye.